Defining psychological disorders is a complicated task. It's not always easy to say what's normal and what's not. Mental health professionals consider many factors. These include how much a person's behavior differs from the average. They also look at personal suffering and the ability to function in daily life. Think of it like a puzzle. There are many pieces. One piece is whether someone is struggling in their relationships or work. Another piece is if they're feeling extreme distress. No single piece defines a disorder. It's the whole picture that matters. Imagine a person who's constantly afraid of going outside. This fear might be so intense that they avoid leaving home altogether. This avoidance can severely impact their work and social life, causing significant distress. This is an example of how extreme fear can become a disorder. Defining these disorders is an ongoing process. Our understanding evolves with time and research. The goal is to provide help and support for those who need it most. There are many ways to understand psychological disorders. Think of these as different lenses, each offering a unique perspective. The medical perspective views disorders as illnesses, much like physical ones. It focuses on factors like brain chemistry and genetics. Imagine a car running poorly due to engine trouble. Similarly, this perspective suggests that imbalances in brain chemicals can lead to disorders. The psychoanalytic perspective, rooted in Freud's work, emphasizes unresolved childhood conflicts. Think of it like a house with a hidden room. These unresolved issues remain hidden but impact our thoughts and behaviors. The behavioral perspective focuses on learned behaviors. It suggests that unhealthy behaviors are learned through experiences. Imagine training a dog. Similarly, this perspective suggests that our behaviors are shaped by rewards and punishments. The cognitive perspective emphasizes the role of thoughts. It suggests that our thoughts influence our feelings and behaviors. Imagine two people looking at the same cloud. One sees a dragon, the other a bunny. This perspective highlights how our interpretations shape our experiences. The humanistic perspective focuses on personal growth and self-acceptance. It emphasizes the importance of meaning and purpose in life. Imagine a plant needing sunlight to thrive. This perspective suggests that we also need positive regard and self-acceptance to flourish. The sociocultural perspective highlights the influence of society and culture. It considers how factors like poverty, discrimination, and cultural norms can contribute to mental health issues. Imagine a fishbowl. This perspective reminds us that our environment shapes our experiences and behaviors. Each perspective offers valuable insights into the complexities of psychological disorders. Imagine a librarian using a detailed cataloging system to organize books. Similarly, mental health professionals use a system to classify and diagnose mental disorders. This system is called the Diagnostic and Statistical Manual of Mental Disorders, 5th edition or DSM-5. The DSM-5 is like a guidebook. It provides specific criteria for diagnosing a wide range of disorders. This helps ensure that diagnoses are consistent and accurate. Think of it as a recipe book for mental health professionals. It provides the ingredients for understanding and diagnosing different conditions. This manual is regularly updated to reflect the latest research and understanding of mental health. It's an essential tool for researchers, clinicians, and anyone working in the mental health field. The DSM-5 plays a crucial role in diagnosis. It provides clear criteria for identifying and classifying disorders. Treatment planning. Accurate diagnosis guides treatment decisions and interventions. Research. It enables researchers to study and track the prevalence of disorders. Communication. It provides a common language for mental health professionals to communicate about disorders. The DSM-5 is an evolving document, constantly being refined to improve our understanding and treatment of mental health conditions. Anxiety disorders are among the most common mental health conditions. They involve more than temporary worry or fear. For a person with an anxiety disorder, the anxiety does not go away and can worsen over time. This can interfere with daily activities such as job performance, schoolwork, and relationships. There are several types of anxiety disorders, including generalized anxiety disorder, panic disorder, and various phobia-related disorders. Generalized anxiety disorder involves persistent and excessive worry about a number of different things. Panic disorder is characterized by recurrent unexpected panic attacks, which are sudden periods of intense fear. Phobia-related disorders involve an intense fear of or aversion to specific objects or situations. Understanding anxiety disorders is crucial for providing effective treatment and support. The goal is to help individuals manage their symptoms and improve their quality of life. Mood disorders, they affect how you feel, think, and handle daily activities. These disorders can range from persistent sadness, known as depression, to extreme mood swings seen in bipolar disorder. It's important to recognize that these conditions are not just fleeting emotions but serious medical conditions that require attention. Schizophrenia and other psychotic disorders involve a distortion of reality. Individuals may experience delusions, hallucinations, and disorganized thinking. These symptoms can be incredibly distressing and disrupt daily life significantly. Understanding and compassion are crucial in supporting those affected. Attention deficit hyperactivity disorder, or ADHD, and autism spectrum disorder, or ASD, are two neurodevelopmental disorders that can significantly impact an individual's life. ADHD is characterized by patterns of inattention, hyperactivity, and impulsivity, whereas ASD is marked by challenges in social interaction, communication, and repetitive behaviors. Understanding these conditions is crucial for providing appropriate support and interventions. It's important to recognize that neurodiversity means there are many different ways of experiencing the world. People with ADHD or ASD may have unique strengths and perspectives that contribute to their individuality. By embracing these differences, we can foster a more inclusive society that values all forms of human expression and potential. Beyond ADHD and ASD, there are numerous other psychological disorders that affect millions of people worldwide. Conditions such as anxiety disorders, depression, bipolar disorder, and schizophrenia each have their own complexities and challenges. Understanding these disorders is vital for reducing stigma and promoting empathy and support for those affected. Moving towards a better understanding of psychological disorders involves continuous learning and open-mindedness. By educating ourselves and others, we can break down barriers and build a more compassionate world. Support systems, whether professional or personal, play a crucial role in the well-being of individuals with psychological disorders. Together, we can make a difference in the lives of those who need it most.